For this occupational therapy portfolio topic, I'm going to be walking through the timed up and go, or also known as the TUG test. So I have my patient sitting here in a chair. Typically this would be done in a standard armchair, but I don't currently have one. So I have my patient sitting in a chair. They're wearing their regular shoes, and I have a spot marked on the floor 10 feet away. So what I'm going to do is I'm going to read you the instructions. So when I say go, I want you to stand up from the chair, walk to the line on the floor at your normal pace, turn around, walk back to the chair at your normal pace, and sit down again. I'm going to be timing you while you do this, and I'm also going to be walking next to you for your safety. So, do you have any questions?
No.
Okay. So again, when I say go, okay? Go. Okay, so this took my patient 8 seconds to complete, which is good for an older adult who takes greater than 12 seconds to complete the TUG test, is at risk for falling, and this test assesses for fall risk, balance, and mobility. While we're on the topic of the TUG test, I want to note that there are 2 modifiers for the TUG test. There's the TUG manual, where the patient will get up and carry an object such as a glass of water during the walk, and there's if this patient takes longer than 14.5 seconds for the TUG manual test, they are at a higher risk of falling. And the second modifier is the TUG cognitive, where a patient will count backwards from a random number between 20 and 100 during the walk. And if the patient takes longer than 15 seconds for the TUG cognitive test, they are at an increased risk of falling. And for the regular TUG test and the TUG manual and TUG cognitive test, if a patient needs to use an assistive walking device, they can.